15 years ago, I was dying. My young life was stolen from me and from my children, and it need not have been. I was healthy as a child. Then, when I was about 17, I started to get ill with sinusitis and otitis media. I was on antibiotics most of the time. I got to know my GP quite well. Then, when I was 20, I got married. It didn't do a lot for a young marriage to be hawking and bobbing all the time. I had to sleep on 5 pillows to stop the coughing at night. I worked in a school for physically disabled children, and at the end of the week I was so exhausted that I spent most weekends in bed. That didn't do a lot for my marriage either. When I was 21, I became pregnant and was surprised to be told that I had no antibodies to rubella. I'd had an injection before I got pregnant. Working with disabled children, I knew that I had to, and I was amazed that I hadn't developed any antibodies. Coping with a baby was an absolute nightmare. I lurched from infection to infection, and everything that I got, he got too. I consoled myself with the fact that I was breastfeeding and he'd get my antibodies. During this time, my doctor gave me 3 further vaccinations for rubella. I was amazed to be told that I still hadn't developed any antibodies towards it. She told me it was just one of those things. I was referred to an ENT surgeon. I had my sinuses washed out numerous times, my septum straightened, and the drainage holes enlarged. Still didn't work. I was constantly ill. When Adam was 2, I developed pneumonia. Luckily, I had friends and relatives who were able to nurse me and care for him, so he didn't go into care. I saw a different specialist, who put me onto antidepressants. She recommended that I try to relax and said that I needed no further treatment, apart from antidepressants. I continued to become more ill. I gave up on orthodox doctors and went to see a range of homeopaths, food allergists and so on. During this time I was constantly ill. I had sinusitis, otitis media, throat infections, bronchitis, stomach upsets, and even a leg ulcer. I remember one day I was out pushing my son in a pushchair. I felt so ill I didn't know how I was going to get us home. I contemplated suicide. My GP stopped giving me antibiotics for my sinuses and said I didn't really need them. I developed pneumonia again. I was referred to a chest specialist. He decided I had asthma and treated me for that. When Adam was 4, I became pregnant again. I was constantly ill. I was sent back to the ENT specialist, who did another operation, which was just about as successful as the others had been. I was still ill with chest infections. Pneumonia was a constant friend. Then I developed bronchiectasis. At a visit to an outpatients department at another hospital, I asked how long my lungs would keep going. The doctor's evasive reply confirmed what I already knew. I was dying. My husband worked in Thailand a lot. I was beginning to think I might have AIDS. My chest consultant took another blood sample and said he was testing for something with a very long name that I wouldn't have because it was so rare. 2 weeks later, when I went back to the hospital, at the outpatients department, I was given a new lease of life. I burst into tears when they told me I had something called antibody deficiency, but they were tears of joy, not sorrow. At last I knew what was wrong with me, and they could treat it. When I got home, we opened a bottle of champagne.
After 20 years of illness, Liz was found to be suffering from antibody deficiency. Chronic lymphatic leukemia and myeloma were easily excluded, as were some causes of protein loss such as gut disease and renal disease. A diagnosis of common variable immunodeficiency was made. CVID is the commonest of the primary immunodeficiencies, affecting about 50 people per million. Now, this may seem relatively rare compared to some of the diseases I've just mentioned, but it's got to be remembered it affects people at the prime of their lives, and if not diagnosed and treated adequately, will cause lifelong morbidity and perhaps death. CVID affects men and women equally, unlike some of the rarer disorders which are X-linked and present in early childhood. Liz's story of recurrent chest infections leading to bronchiectasis and recurrent problems with sinusitis is entirely typical of a history of CVID. The typical diagnostic delay in this illness is about 5 years, and the only other problems which really cause a combination of bronchiectasis and sinusitis are primary ciliary dyskinesia and perhaps cystic fibrosis. Apart from physical signs attributable to the chronic sinus disease and chronic lung disease, splenomegaly is a relatively common finding in CVID. Additionally, and perhaps paradoxically, these patients also develop autoimmune disease, typically autoimmune thyroid disease. Cytopenias, particularly thrombocytopenia, are also relatively common. Testing for antibody deficiency costs a few pence. The first line test is simply to measure the immunoglobulins. Some patients require additional tests such as measurement of immunoglobulin G subclasses or the measurement of specific antibodies against organisms such as pneumococcus and Haemophilus. Although some patients with antibody deficiency do very well on prophylactic antibiotics, most patients will require immunoglobulin replacement therapy. In adults, this is usually provided intravenously. Intravenous immunoglobulin is a blood product produced by pooling plasma donations from several thousand donors. This is done in order to ensure that the product contains a wide range of antibodies which will offer protection against a wide range of organisms. One potential problem with the use of pooled plasma products is the transmission of viruses from donors to recipients. This is reduced as far as possible by screening potential donors for common viral infections such as HIV, hepatitis B and hepatitis C. Just in case any viruses do get through the safety net, further steps are taken, either chemical or physical, to reduce the risk of viruses surviving in the plasma product. The intravenous immunoglobulin that's available to us these days we regard as very safe.
My symptoms were classic: chest infections, throat infections, sinus infections and ear infections, and they should have been diagnosed earlier. I went 17 years without a diagnosis, and that's not uncommon. Having run the Society for People with Primary Immune Deficiencies for 4 years, I've probably met more people who have this disease than anybody else in the country. And my story has been repeated to me over and over again by many other people. Self-help groups like the PIA benefit people with immunodeficiency because we are able to empower them to get appropriate treatment. The support we can give each other also helps us to maintain a positive outlook on life. Children get these diseases as well, and it's important that they're diagnosed before they get lung damage or any other damage, so that once they are treated, they're really well. We're able to give their parents the proper information they need in order to get their children the treatment that will keep them well. We have a test. We have immunologists ready and willing to treat patients with these diseases, and we have immunoglobulin treatment as well. Surely, it's better to test 100 patients and get negative results than to leave one patient living in the hell that I lived in for so many years. There was a huge difference in my energy levels almost immediately. I didn't know you could feel that well. But because of the damage to my lungs, I still get infections. If you are actually diagnosed quickly and treated, you don't get that, and people will be really well on their immunoglobulins. Some of my friends have reacted badly to some of the older products and have had blood-borne infections from it. But that's very rarely. We do get some reactions to the product if we're brewing an infection, headache, shivers, feeling generally unwell, but that can be treated quite well. Why not home therapy? We're people first and patients second. We have a disease that we want to fit into our lives, not fit our lives around the disease. Home therapy allows us to take as much control as possible over our lives. We lead active lives. We want to work. We want to bring up our children, look after our homes, do all the things that you want to do. I once spent 3 hours sitting on a hospital bed waiting for somebody to come put a needle in my vein. When the poor tired houseman did turn up, he was so exhausted that he couldn't find the vein. I had about 3 puncture wounds that day. With home therapy that doesn't happen. What's more, it doesn't hurt when you do it yourself. Home therapy is safe. In all the years that I've been doing home therapy, no patient has required medical aid during their treatment, and no person has ever had a serious reaction. I was dying from an easily recognisable disease. I was lucky. I was diagnosed and treated. But not everybody is that lucky. There are still many people living twilight lives of ill health and even dying through lack of recognition. Do the test. If they look in any way suspicious, refer the patient to a specialist centre with a clinical immunologist. I already have irreversible lung damage, which could get worse and may even kill me, all because nobody believed how ill I was or bothered to do a few simple blood tests which cost only a few pence. As the saying goes, it could be you.